Happy Wednesday, everybody. Welcome back to another episode of To Your Health with Dr. G. I'm Dr. G, Dr. Mark Gomez, board-certified internal medicine physician, practicing at Edward Hospital in Naperville and Bolingbrook, Illinois. Welcome back, everybody. Happy Wednesday. And today's show is going to be really special, partly because I have such a personal connection to my guests today, and I'll tell you a little bit more in a bit. But here we are today on this great Wednesday, and we're concluding my Back to School Health series. And so I launched this series a few weeks ago to talk about really the importance of things that we can do for our kids and our families. Again, health starts early. We want to promote that. Success in health leads to success in life. And so each week we've been breaking this down and saying, all right, here are the tools that you need as parents, as caregivers, to really have the success and set the foundation for your children to be productive members of society, but to be healthy, to enjoy their lifetimes. So I'm so excited today. So today's title, of course, this is Back to School Health Series Part 3, the final one, Dental and Oral Health Care. Again, my name is Dr. Mark Gomez. Check me out on my website, www.drmarkgomez.com. You can check me out on my handles on social media at To Your Health Dr. G. So today, I'm so excited about this show because I know these individuals very well because they've had a personal part of my health. And when you think about oral and dental health, it's such a foundation for overall healthier body. We're going to talk about that in a little bit, but when I was crafting the show, I just knew I had to have these individuals here because they've helped me keep my pearly whites going on, because why not? But again, and I like to eat too, so like you need teeth, unless you get dental implants or something like that, but I want my teeth. So it's such an important thing when it talks about your health and well-being, but dentistry and teeth are so centered. Just like we talk about different parts of the body, each part of the body has a function, but it's part of a whole piece. And again, we want to have success with all aspects of our health so we can enjoy our families and our loved ones. So I'm going to hit you guys with a couple stats, but before I hit some stats, I got to hit you with a disclaimer. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. So welcome back, everybody, and welcome to the new guests that are out there. So how the show works, each week I gather a group of my experts. We talk about a topic. We have a nice little fun discussion and everything. But we want to make sure people have the tools and the resources for success. So we're going to give you guys some information, some tips, and then hopefully the tips that you guys get, you can take to your own healthcare provider and ask those questions and apply them. But again, the purpose of this show is really about building trust and delivering truth. There's a lot of falsehoods out there and misinformation regarding to a lot of aspects of health, and that's why I created the show. I want people to have the right information, leverage my network, leverage me, of course, but leverage my network of professionals, clinicians that are experts at their field, at the top of their game, and they have really sage advice out there for you to take care of your health. So what I want to do is I'm going to set the tone a little bit, and I got these stats from the American Dental Association. So even though we're going to talk about kids today and a lot, I want to just make sure those caregivers out there get some information too. So here we go. Children. This is from the year 2014. 64.6% of children in the year 2014 visited the dentist every 6 months. 20.3% only once a year. 4.4% once every 2 to 3 years. And at least more than 10% of the adolescent and children population last saw the dentist more than 3 years ago. Whoa. And as a medical doctor, I was not aware of this kind of data. And the data maybe be a little bit dated because it's 2014, but I'm shocked. But I'm not too shocked because, again, we still have some challenges about access and trying to eliminate some barriers. But again, this is what we're about. For the adults out there, you caregivers that are taking care of your kids and making sure they're healthy, the adults, 52.3% visited the dentist every 6 months. I know I am one of them. 15.4% once a year, 11% once every 2 to 3 years, and more than 20% of adults last saw their dentist more than 3 years ago. Just disheartening data. But we're going to talk about solutions. That's what we want to do. So what I want to do is I want to introduce my guests to everybody. And I'm so excited about this panel because I've known them personally. I've been, even though I'm not violating HIPAA, because I've been saying to myself, I've been patients in their practice, but they've really helped out. So I want to introduce my first guest, Dr. Pamela Johnson, DDS MS orthodontist, founder and owner of Johnson Orthodontics. Check her out at www.johnsonworldofsmiles.com. Dr. Johnson, welcome to the show.
Thank you very much.
Please, Dr. Johnson, tell us a little bit more about your training. Where did you go to school? And how this theme of dental and oral health care pertains to you on a day-to-day basis.
I did my undergraduate training at Marquette University, 4-year degree in Bachelor of Science, and then I got my Doctor of Dental Surgery degree at Marquette University as well. And after that, I did a general practice residency, hospital dentistry program at Rush Press St. Luke's. And then I did a 3-year orthodontic residency program at University of Illinois, UIC.
Excellent. And then tell us a little bit about just how this theme of dental and oral health care pertains to you on your day-to-day basis. You know, you're in this for a reason to help people. How does that really set home with you?
Well, my day is comprised of 2 different types of patients. So I see new patient exams, and my patients come in usually around age 7, and I do screening exams, and so I'm looking for particular things, airway problems, crooked teeth, bad bites, and then the other half of my day is spent in the clinic actually cementing expanders, tweaking braces, putting braces on, delivering retainers and things like that. So I am fixing bites, diagnosing and correcting bad bites all day long in my practice.
Thank you, Dr. Johnson, for telling us a little bit. So Dr. Johnson and I go back. I actually walked into her office a number of years ago as an adult, and adults can get braces too. I had braces, and Dr. Johnson really helped me out to take care of my overall health and everything. So that's how we connected. So again, I'm all about having connections with the people that I invite on the show, because I think not only they're very personable, but they're so professional and so good at what they do. And Dr. Johnson's like the best in the business. It's true. I've been there, and I can fill out another survey and everything, which I did. But Dr. Johnson has been amazing to me and to my family. I'm so grateful to have you here today.
Thank you.
My next guest, he and I have known each other for a long time. Oh my gosh, I think I might have been a teenager when we first connected, or if I wasn't a teenager, I was definitely maybe early college, freshman or sophomore in college. I want to welcome to the show Dr. Brian A. Hicks, DDS, PC. He's a dentist, founder and owner of Brian Hicks Dental, www.brianhicksdental.com. Dr. Hicks, welcome to the show.
Thank you, Mark. It's great to be here.
Hey, why don't you give us a little bit about your background? Where did you do your training, your residency, things like that?
Sure. I'm a Chicago boy. I've done all my training here in the city of Chicago. Went to Loyola for my undergraduate degree. It was a bachelor's degree in biology, and then transitioned to the University of Illinois in Chicago for my doctorate of dental surgery degree. After that, decided that I needed some more worldly experience, I suppose, so I joined the United States Air Force. And I was a dentist in the Air Force for 4 years. I was in 3 years in California, which is just fine, learning how to mountain bike and rock climb and enjoy the mountains and the ocean. And then after that, they transitioned over to South Korea, where I spent a year in just south of Seoul, South Korea, and had a lot of experience there as well. So been doing dentistry for about 30 years now, and it's hard to believe.
Excellent. And I'm shocked that you just said it's 30 years. 'Cause I've known you for a long time, but I guess we've all gotten a little bit older, I guess. Why don't you tell us a little bit about how this theme of dental and oral health care, we're talking about kids, talking about adolescents, setting the foundation of longevity with teeth and health. How does this theme of dental and oral health care just generally speak to you?
Yeah, so oral health is a part of what we get excited about every day. Systemic health is critically central to my practice. We believe that the oral cavity is a window to the rest of the body. We spend lots of time just talking with our patients, and you've experienced that, Dr. Gomez, and finding out all kinds of things, everything from simple conversations about what's going on with us on a daily basis, which can help us from an emotional perspective, to identifying signs of diabetes, hypertension, a variety of other things, systemic diseases that are perhaps autoimmune in nature. So from dentistry, we can learn an awful lot about the rest of the body. So systemic health is certainly central to everything that we do on a daily basis, not just fix cavities and make sure your gums are healthy.
Thank you, Dr. Hicks. Dr. Hicks and I actually have done some volunteer work together. A couple years ago, I was organizing a really like a kind of healthcare career field day for adolescents, high school, college kids, and some of the astute middle school kids. But Dr. Hicks has been gracious in his time supporting a mission of awareness and really trying to help promote that next generation of healthcare leaders. And I think it's really noble to give back. And I think even Dr. Johnson would probably, she can certainly speak volumes with this and what she's doing, just helping out with just kids in general, special needs kids. And so the experts today have a passion about what they do, and they get fulfilled. I mean, sometimes we can all work a job and you might not be fulfilled, but you guys are both fulfilled. So I just love it that you guys are here. So what we do each week, now that you guys met the panel, I always ask some questions, of course, because we put them on the hot seat. But again, this is information for people, just information, there you go. But it's entertainment too. But I want to give people the right information, so when you go home, you hear our show, you go home and you talk to your children today, talk to your even adults today about teeth, and then you go see your dentist. You get that foundation. I quoted some of those stats where people just don't go. Kids and adults, we want to create that sense of urgency so we can have good and prosperous health. So the question of the hour, aka the chief complaint in medicine, because it is a medical show, the chief complaint, the question of the hour that I have from my panel is, how can we best lay down the proper dental and oral healthcare foundations in our children? So I'm going to ask the first question to Dr. Johnson, and we're just going to kind of get right in it. Let's talk about this. What are some of the examples of some barriers that are out there? We just talked about some stats and people maybe not getting to the dentist, but what's your take on things on what are some of the barriers out there in children to getting adequate dental and oral health care?
Well, I think there are a number of barriers, and one of them might be for special needs patients in particular. There really aren't very many orthodontists that have a lot of experience treating children that have special needs because of oral motor sensory issues, behavior problems, things like that. So that's one barrier in that patient population. But in other patients, I think some of the barriers too, although some of the younger kids think that braces are hip and cool, some of the older children think that braces may not be quite so cool and they don't want the braces. The parents are forcing them into the office to have their teeth straightened when they necessarily don't want the braces themselves. So there's a status issue with a barrier to having braces. Some patients, in fact a lot of patients, think that braces hurt. And they don't understand how braces are put on the teeth, and they have perhaps bad experiences in the general dental office, and that carries over to the orthodontist, and there's a fear of getting braces on. So we spend a lot of time educating our patients as to the process of putting braces on. It's not uncomfortable, it's not painful. There's cool technology now. We don't do impressions anymore. There's very, very, very cool technology where we have scanners and other types of technology that really make the patient experience more pleasant.
Some of those days, you make me think about some of those days growing up, and you get the putty in your mouth,
Right.
and you make the plaster molds, and it's just awful, and then that taste gets on your tongue.
Right.
But that's great. There's so much technology out there. We're going to talk about that in a little bit. Dr. Hicks, I want to get your opinion on some of the barriers that are out there that you see as far as even your adolescent populations. You can even talk about adults too, just some of the barriers that are out there for getting proper dental and oral health care.
Sure. So oftentimes we would talk about the availability of care. We wonder if there are enough providers to care for all the teeth that are out there. And there have been a lot of studies that have been done to find out what is really the core of getting to the dental practice. And what has been found is that really the number one cause is financial. That finding the financial means to be able to take care of your dental needs is difficult in many groups to accomplish. Certainly with children that can be the case, adolescents, and certainly with our seniors as they go on to retirement and perhaps lose dental insurance, it becomes far more challenging for them. Oftentimes dentistry may be looked at as discretionary with funding, and unfortunately gingivitis doesn't hurt and small cavities don't hurt. If they did, there'd be far more motivation to get things taken care of when it's early. But when we're looking at our at our finances, we're looking at our budgets, we're looking at the things that we need to do. Sometimes there isn't enough. And one of the major problems, probably 90+% of the obstacles is financial. So that's the number one barrier, and there are things that we can do about that, and we can chat about that a little bit too.
Excellent. The financial thing is universal. We're seeing it now in my medical practice, just some of the costs that are out there, and you can understand where families are out there. They've got maybe a couple kids in high school or junior high, both parents working jobs, and it's tough because you have to say, hey, in this day and age, you're trying to survive. You're trying to put food on the table, take care of your kids and everything, and take care of yourself. And sometimes you're right, dentistry gets put on the back burner. We don't want it to be on the back burner because it's so important, because there's so many health issues that can happen from poor oral health care, cardiovascular disease, kidney disease, and diabetes risk. A lot of stuff goes on, and so we want to create that urgency. What about, let me ask you a follow-up question, Dr. Hicks, what about like the communities that don't get it? And you think about the underserved communities, inner city communities, as Dr. Johnson mentioned, the special needs communities. What are some ways that we can try to hopefully overcome some of those barriers?
So that's an enormous problem. There are research studies out there that suggest there are over 50 million hours of school that are missed because of oral health infections or problems. You think of a child who's trying to attend class and he has oral pain. He can't focus. He may misbehave, act out a little bit because of those problems. Nutrition may be difficult to obtain because of oral health problems. So it can impact us in many different ways, absolutely, cardiovascularly and diabetes and a variety of others. But our simple day-to-day can be impacted by that as well. There are programs that are trying to generate revenues so that the underserved community, our inner cities, can find access to care. Community health centers are important places. You may be able to find dental access programs where dentists will go to churches or gymnasiums or schools and provide dental care, but it needs to be something that's more consistent. So we talk about expansion of Medicaid, and we talk about the Affordable Care Act and making sure that children actually have insurance so that they can take action to make some differences in their oral health. That will be the primary focus. There are associations that will provide grants to build programs that focus on the needed population. So we have steps that are being taken. I would just suggest that they're probably not quite enough yet. And
we got to move the needle some more. Dr. Johnson, what's from your perspective, from an orthodontist, kind of these same issues? We know, there are kids out there that definitely need braces. I guess Dr. Hicks is starting to say, obviously, step one, start out with getting established. But what are some of the things that you see from just getting people into braces as some of the barriers?
Well, I would agree with Dr. Hicks that finances are a big issue for people that come in for new patient exams and may not start. Braces are an expensive item, and so the financial barriers are definitely there for our patient population as well. And so we, as orthodontists, we also have programs available to help serve the, maybe the lower income or the underprivileged children as well. But I think that more needs to be done, because there's such a need for creating a healthy bite at a young age, so that when the patients then go to the dentist, it's hard to keep crooked teeth clean. And so if we don't straighten the teeth or put an expander in to create extra space so the teeth can grow in straighter, then when they show up at the general dental office, now the dentist has 4 or 5 or 6 cavities to fix because the teeth are crooked and the patient couldn't brush or floss properly. So there's a definite correlation, and a lot of the things that Brian mentioned earlier we see in our profession as well.
What are some of the, I'll see this final question, Dr. Johnson, what are some of the challenges? You mentioned, obviously, crooked teeth are obviously certainly more difficult to clean, and they can lead to other things, but specifically, what other kind of conditions are out there? If somebody's got unresolved crooked teeth, what are they setting themselves up for?
Well, so there is a health link between bad bites or crooked teeth and cardiac disease. It leads to periodontal disease and heart issues, respiratory issues, kidney problems, things like that. But also when the jaws don't fit together well, we can end up having airway problems and also impacted teeth, where the teeth don't actually erupt and they become impacted or stuck up in the bone. Facial asymmetry. Having a bad smile or crooked teeth really leads in the younger patient population to self-esteem issues. And that is, I think, one of our bigger challenges. A lot of times you see children being teased on the playground, being made fun of because of their teeth. They cover their mouth. They're very self-conscious of their teeth. Kids can be cruel at a younger age. Also, teeth that are protruded. I've had patients that have fallen and tripped and knocked out their two front teeth or broke their two front teeth because they're protruded. So there's so many things that we do as orthodontists to try to set up a healthy mouth and a healthy bite for the patient. So it's not just for a pretty smile, but there are a lot of functional reasons why we straighten teeth and fix bites as well.
Dr. Hicks, Dr. Johnson just mentioned the word periodontal disease. Can you talk a little bit more about that? What does that mean? You know, think about gum disease and then gingivitis, periodontitis as well. Can you explain a little bit just on that, like a primer for our audience out there?
Sure. So periodontal disease is basically a disease of the supporting structures of the tooth. The bone, there are little ligaments that tie the bone and the tooth together, and the gum tissues that overlay that bone. I often describe the tooth, how it is encased in the bone, as a trampoline. So the tooth itself is the jumping surface, and then the frame is the bone, and then the little springs that connect the two together are the periodontal ligament space. Those are all very important factors in periodontal disease. The way that we get periodontal disease most typically is by not being able to access the areas with dental floss and toothpaste and toothbrushes, and we allow bacterial plaque to accumulate. That causes a localized inflammation. The inflammation can lead to the gum tissues detaching away from the tooth, away from the bone. It creates spaces in between the gum and the tooth. It makes it harder to keep those clean. Eventually those ligaments break more, the bone starts to erode away, and then we have teeth that are highly mobile, not for orthodontic purposes, but for disease purposes.
And then you have to, a lot of times, take those teeth out.
Yeah,
Take it to that extent.
Yes, it's the number one cause for adult tooth loss is periodontal disease.
So do we see periodontal disease or gum disease in the adolescent population, or are they too young? They haven't just lived on Earth long enough.
Yeah, no, you can have periodontal disease. Oftentimes it's in the form of gingivitis. One of the unfortunate things about children is they're wonderful at healing and overcoming problems. So some of these things can go on and not really raise to clinical awareness. But absolutely, children have different forms of periodontal disease for certain.
When I was a kid, grew up in the '80s, I remember different programs. Dentists would come to our school and teach all the kids, your first grade, second grade, teach you how to brush your teeth properly, try to get you to use some tricks on flossing, the little plastic little filament or whatever that's got a little dental floss in it, and you just kind of stab it up at your teeth, between your teeth. Do those programs still exist? I mean, we're talking about moving the needle, and it sounds like we got to get more in kind of people's faces. Is out there. Have you heard of anything, Dr. Johnson, that's still going on in the education for kids?
Well, so February is National Children's Dental Health Month through the American Dental Association. So our office, every February, I've been practicing 26 years. So for 26 years, my office goes to all of the local schools in our community, and we do exactly that. We teach the kids, how to brush, how to floss. We talk about nutrition, good dental health, why it's important to brush. But I think that the days of having funded programs through agencies, I think those days are over. And so I know we do it as a community service. We're giving back to our community because our community has supported us for all of these years, and we love doing it. We go to maybe 8 different schools in our community every year. We love it.
And how's the response from the kids when they
Fabulous.
do it?
They have their hands up in the air asking questions. They send us thank you cards. It's really just, it's heartwarming. It's a win-win. We really love doing it, and they love having us come.
So I got to tell you a story. When I was I think it was 22. I was a first-year medical student and did some volunteer work in Honduras. And actually, one of the things as a medical student, we're not really going down there to talk about teeth and oral health. We're going down there to hopefully help deal with hypertension and diabetes and things like that. But I came up with a character. I actually did an education as a soon-to-be medical doctor. Came up with a character for myself called Capitan Cepillo, and that means Captain Toothbrush in Spanish.
Oh.
And so I would go to these communities in the middle of Honduras, in the town that I was at, and we go to do those kind of things. And as you're telling me your story of you getting out there, it just made me think of that, Capitan Cepillo. And they kept calling me Captain Toothbrush in Spanish, like the whole time I was down in Honduras. And I go, no, I'm Mark Gomez, I'm a medical student, I'm student Dr. Gomez. No, your name is Capitan Cepillo. And I go, fair enough, let's talk about diabetes now. But it was hilarious. The challenge down there in Honduras when I was down there was that there wasn't clean water to be able to even do brushing and stuff. So we tried to do your best, but at that time certainly the water in those communities were very contaminated with parasites and other kind of things, but you try to do the best you can.
Right.
Sure.
Wow. So let me ask this question to Dr. Hicks. Dr. Hicks, where does nutrition fit? So say I'm like a high school kid and I sort of care about my teeth, but maybe don't, but how does nutrition fit in everything when you kind of talk to your patients?
Sure. So nutrition is critically important. There are foods that we consider cariogenic or cause tooth decay. And high carbohydrates, they get converted by the bacteria that are naturally in our oral cavity and convert that into acid, and then we start to dissolve our tooth structure. So from just a dental cavity perspective, nutrition is critically important. So we try to keep kids off of high cariogenic diets, limit the carbohydrates, the sugars, limit the sports drinks, limit soda pop. You can take a natural tooth and throw it in a can of Coke and leave it sit there for a few days and pull it out, and it's like a rubber tooth. It's no longer because the acid is what is our biggest issue from a dental decay perspective. So nutrition is critically important from that aspect. Dr.
Johnson, what are you seeing? You have some, obviously we all went, I thought I was a pretty good patient when I was in your practice. I tried to do what I did.
Very good patient.
But how do you kind of advise like parents that are out there, even some of the adolescents that are patient of yours, to say it's super important while you're every day you need to brush and floss while you're wearing these braces. How do you get that message across?
Well, so when the patients get their braces on, they get a kit with a new orthodontic toothbrush and dental floss and floss threaders, and they're actually given a demonstration by our assistants on how to brush and floss. And then when the kids come back to see us, which is typically every 8 weeks, we actually grade them on their brushing and flossing in our office. So we give them an A, B, C, or D. We usually hate to go lower than a C, but we give them a grade, and we chart if they need help brushing, and we also recommend that while they're in braces, they actually see their general dentist every 3 months for cleanings instead of once every 6 months. We really recommend they go back at once every 3 months. So we help them along the way with dental aids and with a grading process and referring back to the general dentist more frequently.
You're really hitting home the point. You're really talking about it's education.
It is. It's complete education.
Excellent. Dr. Hicks, I want to ask you this question. I got some stats here. You mentioned about things, foods that are cariogenic, and we're talking about some of the complications of untreated dental caries. I got some stats here, and I thought this was interesting. Again, as a physician, and I'm looking at some of the literature that's out there for your guys' respective professional bodies. And again, some old data. I apologize, everybody out there. This data is a little bit old, but between the year of 2011 and 2014. So for children, untreated dental caries, children ages 5 to 18, about 20% of those kids had untreated dental caries, and I feel like that might be an underestimate on the number. For adults ages between 19 and 64, high number, nearly 30% of adults had untreated dental caries. And then we talk about seniors greater than 65, which I thought was a little bit lower number, but they said about 17% of seniors between the years 2011 and 2014 with untreated dental caries. How do you kind of interpret that kind of data that there's still more work to be done?
Yeah, there's still more work to be done for sure. You know, when you have 50% of the population that does not see a dentist on an annual basis, when you have 17 million children that haven't seen a dentist in over a year, we're missing opportunities to help them with their oral health, both in repairing the damage that has been done by the dental decay, by the caries, and also finding ways to help them stay healthy for years and years and years to come. So the objective of our practice is not to keep fixing things, it's to fix it once and be done and never have to fix it again. And that goes to the educational side of it, making sure that each one of us is armed with the ability to prevent things from happening in the future, prevent gum disease, prevent dental decay. Motivating people to come to a dental office and have their caries resolved can be a challenge, and there's a number of issues that prevent that, but there is work to be done, yes.
I want to ask this question to Dr. Johnson. I think you certainly, you have I was an adult when I was at a practice. I was not a kid. But you know, for busy professionals, you know, the parents that are out there, the caregivers, that maybe getting into the market of saying, hey, you know what, I actually want to do something about my bite, my smile. I've had some crooked teeth all my life. I may not have had access to dentistry when I was growing up, or orthodontics. Now they come back in as adults to see you, but at the same time, they're super busy professionals. How do you kind of advise them on how to make dental care work, balancing out with their hectic, crazy lifestyles of taking kids to practices and work and all that stuff? How do you make that work?
We actually have a very large patient population in our practice. 40% of my patients are adults currently, and we make it work. And you know, I think part of it is just scheduling appointments appropriately. So we have early morning before work appointments, later evening appointments. We're open until 7 p.m. on Tuesday nights. And there are a lot of the new techniques. So for instance, with braces, there are heat activated wires. We're back to the technology. Again, there are heat activated wires that continue to exert a nice gentle force on the teeth from the heat in the mouth. And so the patients really only need to be seen now once every 8 weeks instead of once every 4 weeks, like 15 or 20 years ago. And then now there's also a lot of Invisalign treatment for adults as well. And with Invisalign cases, we typically see our patients once every 10 weeks. And that really helps the adults that have the busy schedules as well.
Excellent. And then how do you, I want to ask you a final question, I think about the kids in your population, they might be doing a lot of sports, all these kind of after school activities, and you're still trying to make things work with them to say, hey, you need to take the time to take 5 minutes of your day, or whatever long it is. How do you make that work and try to stress the importance of having good maintenance of their teeth while they're in braces?
I think it's just every time they come in, it's if there are broken brackets, it's educating them again on foods that they need to stay away from. If they have swollen gums, gingivitis, from bad brushing or not flossing, it's educating them again and demonstrating how to brush and floss better. We spend a lot of time educating our patients in my practice.
Excellent. Let me ask you one other question here, and essentially as we're talking about the kids, you mentioned at the beginning, you can start orthodontics at a really young age, and I think that's one of the things that people don't know about. Some of the research that I was doing is that you can start as early as age 7.
7, correct.
And so I think a lot of parents don't know that.
Right.
What happens at that age?
So we don't put braces on necessarily on kids that are at 7 years old, but we like to screen, all orthodontists like to screen patients starting at age 7. And we are looking for skeletal problems. We're looking to see if a child has a thumb sucking habit that needs to be stopped. It can mold the upper jaw and make the upper teeth protrude. We're looking to see if there's crowding. If there's a lot of crowding or there are cross bites, we would put an expander in, which is a skeletal appliance that widens the maxilla, widens the bones. So sometimes we're doing headgears or we're doing orthopedic appliances to realign the jaws at an early age. You need to do that on younger patients versus the older teenagers if we're going to get good results.
Excellent. Dr. Hicks, I want to ask you this question. I'm going to change topics a little bit. Cigarette smoke. Can you break it down for us? I know from a medical standpoint, actually I did a show on lung cancer last month. We broke it down, but talk about that in relation to the oral cavity and dental and oral health.
Sure. I remember an instance when I was back in dental school, and a patient came in, and I looked at his gum tissue and said, wow, this man is a healthy person. And then I started to evaluate the gum tissues a little bit more closely and found that he had tremendous periodontal disease. One of the big effects of cigarette smoking is that it significantly decreases the blood supply to our gum tissues, which drastically decreases the ability of the gum tissues to respond to local insults and irritations. So from simply an oral cavity perspective, one of the things that we see most is the impact that it has on the health of the gum tissues from a periodontal perspective. Of course, the other thing that we get concerned about is oral cancers. And we can see a very close relationship between cigarette smoking, alcohol use, and oral cancer. We don't see a lot of oral cancer. It's very infrequently, but over the course of my career I've seen them in 2 different cases, and we don't want to see oral cancer. So cigarette smoking is something that if we can discourage our patients, have them find different programs to quit the process, then we absolutely look to do that.
Yeah, I always tell my patients, and from a medical standpoint, if you are smoking, stop. If you're thinking about smoking, don't do it. And again, it comes down to kind of the foundational things, things that we want to do. If you're going to set your body up for health success, you got to do the right things. Now, nobody's perfect, but as you do the right things, I truly believe the body will pay you back tenfold. Dr. Johnson, I want to talk a little bit about, we're talking about cigarette smoke. Kids used to, I don't know, kids aren't really smoking cigarettes today, but they're vaping a lot. And vaping, for those out there that don't know it, it's the electronic cigarette. It's typically a mixture of chemicals. Most of the time there's nicotine in it, less on the carcinogenic or cancer-forming or really dangerous pollutants in there, but there's usually still nicotine in there. And so a lot of kids are actually vaping these days. The high school kids are doing it. And we actually talked about this on my show a few weeks ago, but do we know is there any data out there on vaping and in the dentistry data and kids? Have you seen anything, Dr. Johnson, or even comment on the kids that may be smoking while they're in braces? But are you seeing anything?
Well, first of all, my patients are typically getting out of braces by the time they're going into high school. So most of my patients are finishing with their orthodontic treatment in end of 8th grade, maybe the very beginning of 9th grade. In my private practice, I haven't seen very many of my patients doing that or smoking cigarettes either. So I don't have a large patient population that I can comment on that's experienced.
That's fair. Have you seen anything, Dr. Hicks, in some of your adolescent population or high school population?
Sure. So I have not seen a lot directly in the practice. What I can tell you is that we're very concerned about it. Nicotine is addictive. Nicotine is in the vapors that are being inhaled. One thing we don't know a lot about is the carrier of the nicotine. So there are a variety of different liquids that are heated to high temperatures that turn into the vapors that are then inhaled. Antifreeze is one of them, propylene glycol. There are things that are involved in the process of vaping that we really don't know a lot about yet. But there is definitely concern. So, and if kids are doing it, our worry is that that's just the entry-level cigarette smoking.
Yeah.
And nicotine is the addictive component, and that's there. So we would prefer that we not even start, just like you said.
And then in your adult population, I know certainly for my adults, and I only really see adults. I have some adolescents in my practice, but mainly 18 and over. But I'm stressing the importance not only hey, cigarettes make your breath smell, you get all this kind of oral health issues, but then thinking about those more systemic issues that are out there. It's still a barrier though, because I still try to say, it's interesting, people come to see me and they want my opinion on things, so I'm going to tell you my opinion. I don't want to come off and say, oh my gosh, they say, oh, Dr. Gomez told me he berated me on quitting smoking, but I consider myself as a consultant to basically give people, hopefully people have the tools to do well with their health. The old saying, I used to work for a doc, used to always say those things where it's everybody said it, but you can say, hey, you can lead a horse to the water, but you can't make the horse drink from it. And I think your health is, we want to give all our patients out there, and these doctors here today talk about just the tools for success. And I think that's super important to remember when we do things like that. I want to ask the next question. I want to change topics a little bit. So I want to go back to, it's interesting because I was in braces as an adult. I actually had braces 2 times, braces in junior high and then as an adult to fix a bite issue. But we always talk about like braces as a rite of passage. Dr. Johnson, is that still the case? It's like you gotta have braces. It's a rite of passage. You're growing up. You're in 7th, 8th grade. You get the braces, and there you go.
I think that, yes, it's kind of like you get your wisdom teeth out as a rite of passage before you go on to college. And so I think that that is sort of a rite of passage. The majority of people could benefit from orthodontic treatment. There are very few people that couldn't benefit from some type of orthodontic treatment.
Excellent. Thank you for and again, you're stressing the importance because of all the things that we're talking about. If the teeth aren't healthy, if they're not straight, if they're not clean, it leads to a whole host of things. And I like how, Dr. Hicks was saying earlier about bacteria formation. I mean, that's the centerpiece. Inflammation and bacteria is a centerpiece when we think about whole body health challenges with poor oral health and things that things that you can get put into risk for. It's literally inflammation and bacteria as it seeds the rest of the body. So, excellent. I want to ask Dr. Hicks this question, and I love this kind of thing. One of the things that I talk about in my practice is just having an integrative approach. I always say, you got your medical doctor, and I do say this honestly. I say to my patients that come in for their physicals, their annual exams, go, well, first I check when was the last time they saw me, if they're new, when was the last time they saw a doctor. The second question I ask, when was the last time you saw your dentist? So I try to give my props to you guys, to my patients in practice, because that's so important. And then I say, when was the last time you had your eyes seen? So I kind of call it the healthy trinity of your medical doctor, your dentist, and your eye doctor. Well, let's talk about a little bit of the importance of an integrative approach. We're talking about team-based care, patients that need services from different practitioners. What's kind of the role between like the dentist, the oral health professional, and the medical doctor? Tell me about some of the relationships that you guys have. I know we're talking a little bit off air about some of the relationship with the primary medical doctor or specialist, but I'll ask you first, Dr. Hicks.
I think a collaborative approach to overall health, systemic health, is critically important. And dentistry has probably been a little bit lower on the totem pole as far as how we're looked at from a medical perspective. I do believe that that's changing a bit. I think that a lot of the medical programs now are focusing more on oral health and recognizing that it is a window to the rest of the body. There are many things that I come across on a daily basis. Patients complaining of migraine headaches and have been taking medications for migraines for long periods of time, and we talk about bites, and we discover that, well, maybe it's not a migraine. So having conversations and a collaborative approach, there certainly is something that dentistry has to offer to the medical community.
If I
Yeah,
may
please
add,
go right ahead.
I feel as though the medical profession is also reaching out more towards the dental professionals on TMJ issues.
Oh, yes.
Because
Oh,
you
yeah.
guys, I'm sure, see a lot of patients that have pain in front of their ear, and they think maybe they have an earache, however it's a TMJ problem. And also sleep apnea. I think airway now is huge, and I know that in dentistry there are a lot of different techniques and things that are being done in dentistry to try to get patients off of CPAP machines. So there's definitely a correlation with the dental community and the medical community for airway, for sure.
I'm so glad that there's those options out there. Certainly, we were talking a little bit before we got on the air about the importance, well, obviously, the importance of sleep apnea. If you have untreated sleep apnea, it sets you up for a whole bunch of medical challenges in relation to heart disease, raising your risk for stroke. So there's so many different things that are out there, and so this integrative approach is so important. And my patients, the biggest complaint of having sleep apnea is using that darn CPAP machine.
Right.
So it's great to know that you're seeing this as well too, this integrative approach. What other kind of integrative approaches are you seeing, being an orthodontist? What are the other kind of medical specialists you're working with to take care of some issues? Are you working with some of the ear, nose, and throat doctors? Are you working with, what other kind of clinicians are you working with?
We do work with the ENT specialists, particularly for the patients that have a very narrow palate. Sometimes just widening the palate with an expander will help open up the airway, but we also evaluate the tonsils and the adenoids, and a lot of times if the tonsils are enlarged, it can lead to airway problems and the mandible, what we call high angle cases where the mandible starts to grow more vertical than it should. So then it creates a bad bite or a malocclusion as well. So we do refer quite a few of our patients to ENT specialists.
Excellent, thank you.
Mhm.
I want to, before we get into my favorite part of the show that I've been doing lately, the myths versus facts, I want to ask one more question, and it's an important one too because we're talking about prevention. So I want to ask a question about the role of HPV or human papilloma virus that we're seeing in this in our populations. Human papilloma virus it can cause it's most commonly associated when you think from a medical standpoint, cervical cancer risk, also causes warts in the body. But when we think about human papilloma virus related oral lesions, we're seeing a rise in that. And some of the data that I've seen, it says about 70% of cancers in the oral pharynx are linked to HPV. So you look at tonsils, soft palate, base of the tongue. What are we doing about that? I know from a medical standpoint, I'm like, you got to vaccinate like crazy. But Dr. Hicks, what are your thoughts on that?
Yeah, we do oral cancer screenings on every patient at every appointment, and from our perspective, we look to see the signs and symptoms of any kind of oral cancer, and we refer. We don't question whether it's something we need to be concerned about or not. We
Just
refer. We use a lot of photography that we can take digital photography, send it off to specialists, and put it into the hands of people that can make important decisions and take immediate action to make sure that it's not a big issue.
And
Go
if I
ahead,
may
Dr. Johnson, yes.
also make a comment, we do oral screening, oral cancer screenings as well as specialists. And typically, in years past, it was mostly the general dentist that did the screenings. And the rise in the HPV situation is it's climbed so high, so we are now screening all of our teenage patients as well. The problem with the HPV virus, if there is a lesion, is really there aren't any symptoms, and so we have to visually see that lesion because there aren't symptoms. And so I think it's important for all dental professionals, whether you're a general dentist or a specialist, I think we all need to be screening all of our patients now for HPV.
Excellent. The more we do for screening, the better we're going to have those outcomes. Again, moving the needles. So I want to get into a section that I created a number of shows ago on this program. I like to call it myths versus facts. We're talking about giving people education, the right tools to be successful with their health, and really kind of getting rid of that misinformation that's out there. So here we go. Dental and oral healthcare myths versus facts. I'm going to ask the panelists, I'm going to say a statement, and then you're going to tell me myth or fact, and then maybe a sentence or two about why. All right, Dr. Hicks, you get the first one. Here we go. Myth versus facts, the dental version. Sugar is the most common cause of cavities.
Sure. Yes, absolutely.
Myth or fact?
It's a fact. It's a fact. Mhm.
Excellent. And can you give us a sentence or two about that?
Yeah, sure. Our diets are critically important. If we eat foods that are highly laden with carbohydrates, the bacteria break it down, turn it into acid, and it dissolves our teeth.
Excellent. Thank you. All right. Dr. Johnson, here we go. Myth versus facts.
Okay.
This is an orthodontist question for you.
All right.
I love it. here we go. My diet will be limited by braces.
Myth.
Okay. And can you give us a few sentences why?
So a lot of patients come in and they think once they get braces on that they're not going to be able to eat certain foods. It's really, you can, for instance, apples. When you have braces on, you can't bite into an apple, but you can certainly cut your apple into slices or wedges and eat your apple that way. Same with a carrot stick. You certainly don't want to bite into a carrot stick, but if you cut or dice your carrots into small pieces, you can certainly eat your carrots that way. Popcorn. It's the seeds that we care about. So when the kids shovel the popcorn into their mouths and there are unpopped seeds, that's what pops off the brackets. But if they pick through their popcorn and they're eating the big fluffy pieces, it's okay to have popcorn.
Excellent. Dr. Hicks, here we go. Here's a statement. Flossing isn't really necessary anymore.
That would be a myth.
And please tell us why. I agree. That's a big fat myth.
No. Toothbrushes are fabulous, but there are places in between teeth that the brushes just simply don't reach. We need to get in between our teeth, get below the gum line in between the teeth. Electric toothbrushes have done a lot to help us with that because to be honest, getting people to floss on a regular basis is an immense challenge. But no, that is absolutely a myth. We need to floss.
Thank
What
you.
about the water pick?
Oh yeah,
As
good
a-
question. Yeah, great
So
question.
the water pick is okay. It's an adjunct, but it's flossing that we need to do.
Excellent.
Flossing we need to
Here
do.
we go. Myths versus facts. Dr. Johnson, here we go. Here's a statement. Braces must be tight and painful to work.
That is a myth.
And please tell us why.
So as I commented earlier, we have these wonderful heat-activated wires now that we use in the office that exert a nice, soft, gentle force. And it's so much easier to have braces now than it was 20 years ago. It really isn't nearly as uncomfortable as it was 20 years ago or 15 years ago
Excellent.
because of the technology.
Excellent. We'll do 2 more of these. Dr. Hicks, here we go. This is going to be great. Chewing sugar-free gum is just as good as brushing.
That would be a myth.
What? That's a myth.
Yeah,
please,
sorry.
please tell us. Please explain. A couple sentences on that.
Sure. I think that pretty much piggybacks with dental flossing. There are places that we simply can't get to. The chewing gum simply won't remove it. It increases salivary flow oftentimes, which is great because we have fluoride in our saliva if we're drinking fluoridated water. But no, it does not take the place of
Thank
brushing
you.
or flossing.
And the last myths versus facts for Dr. Johnson. Here we go. Braces will set off metal security detectors.
I hear that all the time. That is definitely a myth. So that does not happen.
Excellent. I was going to say, I did travel when I was in my braces. I did travel. My wife and I went on vacation a couple times, took the kids, so I did not set up any metal
No.
detectors
No.
at the airport. All right, so we got about 5 minutes left, and so what I want to do is I kind of want to bring this home. We've been having some great discussion about really setting down the foundation for oral health and how it can be a window to just general health. But really the importance, it's about education. So what I want to do is I want to ask the panel today to just kind of give us a few take-home points. And we kind of call this the assessment and plan section. The assessment and plan in health is when people, you see your patient and then you kind of wrap things up and tell them their diagnosis and their treatment strategy for the day. So Dr. Hicks, why don't you start us off with just a few take-home points about the importance of dental and oral health care.
Sure. As you commented, Dr. Gomez, there still is a significant degree of dental caries out there. There's a significant degree of people who do not attend dental appointments on a regular basis. I can fix teeth. I can do beautiful work fixing teeth. My dentistry is nowhere near as good as your own natural tooth structure. Taking care of your own mouth is far better than anything in the dental health field that we can do. So brushing, flossing on a regular basis, being mindful of what you eat, making sure that we're not having that cariogenic diet, and that's important for us systemically too. Starting early, parents, pay attention to your children, spend time with them. It can be fun. Go and brush your teeth together. Make it a family thing. Make it something that can be enjoyable. But take care of your teeth. Your teeth are better than anything that we can replace them with.
Excellent. Dr. Johnson, a couple take-home points.
Well, I think I'd like the audience to just know that early orthodontic treatment, whether expanders or braces, really sets up a foundation for a better bite. And if you have a better bite, that means there's going to be less wear and tear in your natural tooth structure, which means less restorations from the general dental office when you're older, less crowns and things like that. But also, I feel like it's important to have a nice smile just for self-esteem purposes. There's research that shows that people that have nice smiles get better job opportunities, they feel better about themselves. And so there's a self-esteem issue, and also there's that health issue. Having straight teeth means you can brush and floss and keep your teeth healthy longer. So again, we're not ending up with periodontal disease in our general dental office as well.
Excellent. And my final points are this. Really, we want you to set up that foundation. We talk again about showing up in your health, showing up in your life. Setting that foundation is super important. So when we think about your teeth and your oral health as a physician, I say that is a foundational way to take the best care of your health. Everything enters through the mouth. Think about the foods we eat. Think about the things that we do. we want to just have fun, but we want to be healthy at the same time. It says your oral health is really an indicator of your overall health, and I want to stress that importance. Go see your dentist. If you haven't been, do it. Grab your wife, grab your husband, grab your sister, grab your brother. Go. The data is out there. We got to do a better job, and I want people to feel inspired to live healthy and active lives. I want to thank my guests, of course, today. We got Dr. Pamela Johnson, owner, founder, orthodontist at Johnson Orthodontics. Check her out, www.johnsonworldofsmiles.com. And we got my good friend, Dr. Brian Hicks, DDS PC, dentist, founder and owner at Brian Hicks Dental. Check him out, www.brianhicksdental.com. Next week on the show, we're going to be talking about Food Allergies 101. It's going to be exciting. Again, my name is Dr. G. Check me out, www.drmarkgomez.com. Peace out.